So aloha and welcome to this discussion on the COVID vaccine, as well as on healthcare disparities, within the Native Hawaiian, Micronesian, Filipino, and Black communities. With me here now, we have, first off, we have Dr. Neecey Hudson, who is a computation biologist and has a PhD in interdisciplinary in bioengineering, biostatistics, and bioinformatics from MIT. She's also the chairperson of Hood Medicine Initiative, which is a nonprofit collective dedicated to protecting Black lives and improving the health of minority communities. So mahalo, thank you for coming on to this.
Thank you for having me.
Next, we have Noelani Ahia, who is a healer, La'aula Pa'au practitioner, and one of the co-founders of Māhū Medics. Māhū Medics, for those who may not be aware of it, was a crucial force in the protection of Mauna Kea, especially in last year's actions against the TMT. So mahalo for being here, Noelani.
Mahalo nui for having me. Aloha.
And then we have, of course, the incomparable Kahala Johnson, who is a graduate student. You're also teaching, right, this semester?
Yes.
Political science. Kahala is one of the co-founders of Hale Māhū, which provided space and ea for Kanaka who were Māhū or identified as LGBTQ. Next, we have Nadine or Ne Sogeni, who is a Micronesian youth organizer and young Pacific island leader who traces her roots back to Chuk. She has had several positions working on projects for a number of public humanities programs centered on Micronesian youth and immigration issues. So thank you for being here. And last but not least, we have Clarissa, who is a second-generation Filipino X and first-generation college student interested in investing in community-oriented spaces to promote music, art, and culture. Clarissa is studying ethnic studies to help her better centralize the BIPOC experience when navigating predominantly white spaces. She continues to seek out these experiences to aid in creating safe, community-oriented spaces for future generations. Maraming salamat for being here. Okay, so why don't we get into it? There's a lot of, what are some of the things within your community that has happened that's being said about the COVID vaccine?
I'm sorry, was that for, oh, sorry, oh my God.
Oh, sorry.
Oh, no, go ahead.
I was
Okay.
just, there was a prolonged silence and I was like, I just dropped out, so I hope that wasn't a question for me. Sorry, go ahead.
What are, so like within the Native Hawaiian community, what are some things, Kahala, and I'll direct this to Kahala and Noelani, that you have heard in regards to the information being spread about the COVID vaccine?
Okay, I can speak to that. Just real quick too, I just want to clarify, I actually am not a trained La'au practitioner. I practice Chinese medicine. So I have a master's in science in traditional Oriental medicine, and I aspire to be a La'au practitioner of our Kanaka medicine one day. But, you know, I think there's a lot of distrust of the Western medical system for our Kanaka Maoli people, and for good reason. There's a lot of confusion. There's a lot of misinformation. I myself have my own distrust, to be honest, not of the science, but of a profiteering industry that has benefited financially off of our illnesses. And it's really, really challenging to know sometimes what is the right decision when it comes to taking a vaccine and whether or not it's safe, whether or not it's healthy, what are the risks, what are the benefits. And so I'm really, really glad that we have Dr. Neecey here tonight too. I understand that she's going to share some mana'o about that and help even us as healthcare practitioners understand what's going on with the new research that's being done and the vaccines that have just been released, because I think there's a lot of concern and people are afraid that it's going to hurt them. And for good reason, because we have, you know, well, between infectious disease, which of course, as you guys know, we went from almost 1 million people in our population to 40,000 in a span of just a little over 100 years. There's a lot of sensitivity and historical trauma just around infectious disease in general. And so I think sometimes that impacts how we actually feel in our bodies about this whole pandemic and the fears and the confusions about it. And we're trying to make heads or tail of it. And then we're getting misinformation, and there's a, you know, a huge conspiracy theory about vaccines. But the thing is that with conspiracy theories, right, there's always like a little slice of truth somewhere in there. And so it's trying to kind of trying to weed out what is a conspiracy theory and what is actually something that we need to be concerned about and be educated about. And so I think there's just a lot of fear around it. People are afraid of getting hurt by it. And so I think we definitely have to talk about that. What are the risks and what are the benefits?
I can totally understand that, because for us, I mean, obviously that, like, we have so much shared history of like unethical human research and, you know, medical abuse and healthcare disparity and access for that matter. And, you know, I think, you know, what I want you guys to be able to take back and communicate, you know, to your communities, to your families, is that unlike maybe, you know, your ancestors who were ravaged by a disease, you know, and didn't have a way to protect themselves, you know, you have a gift of time in the vaccine in a sense, because, you know, with, you know, modern medical advances, you know, we can all benefit from having, you know, this rapid, sophisticated vaccine platform, you know, deliver something immediately to the market. And, you know, I feel like, you know, just sort of, you know, taking in what you're saying and what, you know, I've learned about you guys over the past couple days from my chats with Adam, and how your monomedics group started, you know, I kind of feel like, you know, like you said, it's not like the science that you distrust. And I understand personally, you know, mistrust of doctors, you know, as a Black woman who gets terrible, you know, medical care. I'm looking for a new doctor right now. You feel me? Like, I don't trust doctors. But I do trust the science. You know what I mean? I don't think scientists have been compromised at all. And I feel like your ancestors, you know, your people in general, you know what I mean? Like, they were scientists, you know what I mean? They were navigators and ecologists and healers, you know what I'm saying? So I would like to think that, you know, it would make sense that hopefully now people would understand that, you know, you're living in an era where you're able to protect yourselves in a way that they weren't. Do you know what I mean?
Yeah, absolutely. It makes
Yeah.
a lot of sense. It makes a lot of sense. And I think our people do, you know, understand that we're coming to remember that we were scientists. I think we were lied to for a long time and told we were stupid.
Yeah.
But we're remembering now, we're waking up to the fact that our ancestors were brilliant. I mean, they're brilliant.
Yeah.
I think
Yeah.
the question is always, though, not so much the science, but the profiteering of an industry. And I think that scares a lot of us. Like, I think for me personally, one thing that makes me a little less suspicious is that this is an international effort to create a vaccine for the world. It's not necessarily America-oriented or even Western world-oriented. There are a lot of people that participated. I have read through some of the studies, one of the studies, the Pfizer study, and I can see that there are a lot of people that participated in the study from a wide variety of backgrounds, and I appreciated that sort of international approach to finding a solution. You know, even if it's not the answer to everything, it might be a piece of the pie that we really need to protect our people. So I'm keeping an open mind about it. Thank you.
Good.
Okay, I would like to pose the same question to Clarissa. What are some of the things that are being said within, or from what you have heard or seen from the Filipino community, which the Filipino and Micronesian communities are the most disproportionately affected by this?
So what I've been hearing is a lot of like people my age, their parents are in the medical field as nurses, so they're really for the vaccine. A lot of them have gotten the vaccine within the past like week, I guess. So they're really excited for it. And then also at the same time, like a lot of nurses, like in New York, did pass away, and they happen to be Filipino. And it's also of like the lack of PPE provided during the beginning of this kind of really did them in, because they weren't allowed to even like bring in like homemade masks to even like protect them, like at the very least. So at this point, they're really like pushing for the vaccine, I guess, and they're kind of just at this point at where we're at with the pandemic. I think it's something it should be readily available for everyone, not just for people in the US, is at least that's what we've been hearing.
What are your personal concerns about the vaccine, Clarissa?
For me, I guess like if it doesn't work, or if like there are negative effects that would like affect people's health negatively instead of what it's supposed to be doing. But I guess from like vaccine, like with previous like pandemics, like the swine flu vaccine and avian flu, those like were okay, and it was able to like protect people. So I don't know, I'm still cautious, wary that like people will be negatively affected, and especially like those who are the disparaging communities, like the Black and Indigenous people, will be negatively affected. And that's not like what I want to see out of something that is supposed to protect us and have us be able to, I guess, go back to this new normal.
Nadine?
I really can relate to what Noelani was sharing, because there are remnants of colonization and war in our waters in Micronesia, right? And that's why many immigrate out, and part of the migration pattern comes through Guam, where I'm living right now, and then Hawaii, and some parts of many parts of US now. What makes it very sad is there's still many people that I know who are risking their health for this reason, for economic reasons. And I know that's kind of weird to like say it here, but it's almost hand in hand in the way some of my community members operate or continue to live. Like they have no choice but to continue to work. They have no choice but to leave their COVID-free homes or islands to go to places like Iowa to work at the plants, where we know there's been such a great surge in cases, but at the same time, there's not been a lot of coverage or news about the way it's being handled. So I remember talking to a relative, and he said, "Oh, it's pretty okay here." And I was like, I don't think that's really accurate, because there's other news, trusted news source that you can believe they're bringing out a fair and balanced news article. But there's people who kind of don't think about that yet because they feel like they're going to go places where they can help their communities. Now, at the same time, these same people don't have access to healthcare to protect them in the event that they get sick because of not having a choice to stay home or to how to provide. And that's the part that really gets me because there's a divide in my, at least the communities that I communicate with, that they're for they believe in what's going on, and some who unfortunately believe the conspiracy or the or some of the guided news kind of being put up by people who want to kind of downplay the illness. And so I feel like the communities that I know are divided in that way, and there's no real consensus because they have other things they feel like they have to worry about as opposed to actually getting it or having the means to address it should the time come. And I feel like that's so ironic because that's the kind of state the pandemic has kind of put us all in. But in the very, very bottom ground level, there's people who don't have that option. And that's the community that I'm trying to always reach out to or try to kind of get them to challenge or to kind of get more comfortable in challenging that's the condition that they're in. But it's still very hard to this day. And I still don't know how to fix it. So I'm still at a loss really, but I know of, there's a divide. I can really say there's a divide between people I talk to here in Guam and relatives out in the mainland. So it's just sad.
Okay, I wanted to actually tackle the conspiracies first, which we kind of did already before moving into the more of the history. But I wanted to ask if Dr. Neecey would kind of explain how this vaccine works. And for our viewers out there, Dr. Neecey is not in any way affiliated with Moderna or any of the companies involved with this vaccine, but her studies involve vaccines. So we're getting a more neutral voice. So I was wondering, Dr. Neecey, if you can kind of explain in layman's terms how the Pfizer and the Moderna vaccines work.
Sure. So, so first of all, I guess I'll back up a little bit and talk a little bit about coronavirus itself, because then you'll understand a little bit better. So, so essentially, it's a lot like a lot of other viruses in that it is parasitic for one, so it needs hosts to survive, unlike bacteria or something, for example. And it's made up of essentially, in general, viruses are made up of generally like a piece of DNA or a piece of RNA, and just like encased in a protein. So with COVID in particular, this one is an RNA virus, and it's got little spikes on the outside of its protein shell, right? And so we've all heard about those spikes, and that's what helps the virus get into our cells. And so once it enters your cells and the cells that the virus infects, it's almost like, you know, like, give me your copy machine, I'm going to make my own copies. And so that cell then, instead of following your DNA code and making proteins for your body the way that you were programmed in your genetic code, it starts translating the virus's RNA instead, and it starts making viral proteins. And then ultimately the virus is like, you know, hijacking your cells to make what it needs to produce more viral particles. And that's sort of what we're spreading amongst ourselves in our breath and the droplets. Why it's so important for everyone to keep their masks covering their mouth and their nose, because those are the particles that are being spread in the air. And so, so with the vaccines, they sort of, unlike maybe traditional vaccines that you know, use like maybe like a weakened form of the virus, like the flu, for example. So this is an mRNA virus, which is messenger RNA, and it's a way for sort of the vaccine to deliver a little cheat code to your cells. And so your cell can kind of produce just a little piece of that spike protein on the outside of the virus, and then use that to like run and go tell your immune system, hey, check this out. This is a viral protein. If you see this, kill that cell because we gotta, you know, get rid of it. It's a problem, you know. And so then you retain that in your memory, and then that's like essentially how you build immunity over time. And you know, unlike maybe, I don't know, the chicken pox or the flu, for example, you know, the importance here with getting the vaccine is that, you know, it's not as maybe harmless as some of the other things that we are more familiar with can be. We don't really know all of the health effects and the long-term, you know, consequences of illness. We know that we've seen some people that have recovered pretty quickly, some people who have like sort of long COVID, as they say, where they're having continuing symptoms like months and months afterwards. And we're not just talking about like still feeling under the weather, we're talking about like brain damage and serious cardiovascular disease and kidney problems. Like people are having like serious, still can't taste food, for, you know, for some reason. So, you know, it's like sort of, for me, I guess, what I want to communicate, like in terms of the importance, is that, you know, I want to communicate the stakes. You know, we're talking about either serious illness or certain death, or maybe roll the dice and you're with the, you know, one of the people who just like sneezes for a week and then you're fine, I guess, you know. But that's a really big chance to take, you know. And I think especially now, like that, we're kind of seeing how people are completely unable to follow the recommended guidelines of social distancing and wearing masks. And unfortunately, because of all the disinformation and all of the sort of propaganda and conspiracies around the like denial of the virus, it makes it harder to get through to people just what they're risking by refusing to do something as simple as covering their face, or like just staying in the house and being still for a little bit. You know, I'm really thankful that they've utilized, you know, this really cool modern technology to kind of rapidly scale up the vaccine and, you know, starting to roll it out. Because if we had to wait any longer on humanity, we'd be doomed, because nobody is doing what they're supposed to do. It's seemingly impossible to combat. And so it's so important that we all encourage, you know, the people that we're doing the grassroots work with to get the virus. I mean the vaccine rather, because it's like, you know, they're starting to roll it out, at least in Hawaii soon. And they're starting with sort of like the essential workers and the top tiers that they had laid out. And, you know, sort of my charge to all of you is to make sure you mobilize your communities to be ready to go get it when it comes out, because it's a no-brainer kind of thing. You know, it's a way to start to build immunity against, you know, a completely relatively unknown virus. And we know a lot about coronaviruses in general, but this is a novel virus, and, you know, we haven't had any time to collect, you know, the kind of data that we'd like to have. but what we know already is that it's really dangerous. You know, it's not a hoax. You know, there's a lot of dead bodies piling up, and so people need to really take it seriously. Especially, I mean, you know, I think we really got started because we were trying to think like, what can we do, or what kind of information and aid can we get to those, you know, those people, like the people that like don't have choices at all, you know, like, and it's hard. You know, I kind of, you know, I hear what you're saying, and I just, you know, it's something that we've been thinking over for a long time, and I feel like where we're at now is just, it's impossible to, like, you know, as I'm sure you all know, it's almost impossible to conceive of how we could help people right now that have no choices, when we live in a society that prioritizes the economy over human life. And we live under an administration that has chosen to do the exact opposite of everything that one would need to do to prevent the spread of this disease. And now the map is completely red. And I'm at a loss to even think about, like, what do you do to even help the people who can't go 5 minutes without risk of exposure? I don't know, but I do know that if we can at least encourage them to get vaccinated, they will have a chance to be protected, you know, in terms of, you know, their physiology and their body having what it needs to fight off infection. And that's the best we can do right now, you know what I mean, to keep people alive until we figure it out.
So basically, the vaccines work as they communicate to your antibodies that to look out for this particular strain, or
so
I want
essentially,
you to
like,
kind of break it down a little bit more.
yeah. So essentially, you, like, the injection itself, you know, they do the injection sort of in your arm, right? And so then your muscle cells get the code, right? And then they start to make a little piece of the spike protein from the virus. And that's going to be like basically that piece that normally, you know, that normally anyway would elicit like the immune response that would be taken to the immune hub and the lymph nodes, and everybody would like put it in the library and remember it for next time. This way, we're just kind of, you know, kind of accelerating that process by having one of your cells receive the cheat code, make the protein, and then show the protein to everybody, like have a big party and be like, guys, check this out. This is like the culprit. Next time you see it, like, kill it. So that's essentially what happens with the injection. And that's really what any vaccine is doing, is exposing you to whatever pathogen that you're protecting against, in a way that doesn't cause disease, but that does produce an immune response, so that your memory cells and your immune system will recognize it, so that next time your body will send its attack cells to go kill it as soon as it sees it, you know. Right now, none of us have been exposed to COVID, so none of us have any immunity towards it. It's a novel virus. It just jumped from animals to humans. And so, you know, that's part of the problem. And then also, you know, as we've seen, you know, what they've said is that they haven't seen like lasting immunity in people that have been naturally exposed. So meaning, you know, if you get COVID just from being exposed to someone, you know, they're not seeing sort of retention of antibodies over time. And so that's the other thing that's really important about the vaccine, is that unlike chickenpox, for example, where you could just get exposed one time and then like you're good for life, you know, in this case, people who are getting COVID aren't having that lasting immunity where their cells are remembering what it was. And so that's why, having the vaccine is so much more important, because that, is a way of building immune protection within individuals over time. And then it contributes to what's, essentially the notion of herd immunity, wherein, if you're in like a crowd or a herd of people, and, for example, like right now, like none of us have been exposed to this virus before, none of us have been vaccinated, and so if we're all in a herd with no masks on and, all just standing around breathing in each other's faces, and there's one infected person in that crowd, two, there's probably five at this point, as red as the map is, 5, 6, 7, 8, if there's that many infected people in that crowd and no one's been vaccinated, then it's easy for the virus to spread from person to person to person, because it's all about proximity. The virus is really, sort of really small, and it travels in your breath droplets and it lingers in the air, and even, when you're inside with people with a mask on, no ventilation, essentially, after a few minutes, you're still breathing the same air. And so it's like, that's part of the reason why it's so contagious, is because it lingers so long in the air. And so also why it's so important for us to socially distance and stay isolated, because it lingers so long in the air. And so if all of us in that crowd where COVID is lingering in the air and nobody has a mask on and we're all breathing or whatever in that crowd, and none of us have been vaccinated, then none of us are protected. And that's why our map is as red as it is right now. But once people start getting vaccinated, and for example, like in Hawaii, they're saying or estimating that at least like 70% of your population needs to be vaccinated in order for you to begin to start establishing herd immunity. And I guess that's the imperative of that, implicit in what I'm saying to all of you, is that every 7 out of every 10 people you see, you need to encourage to get the vaccine, right? And so that's a lot, like those are the odds that we're looking at, to where like, once everybody is starting to get vaccinated, then when you're in that same herd and that same crowd again, if the majority of that herd has been vaccinated, then the virus isn't going to have that much of a chance to spread from one person to the next, because, if there's one infected person in that herd, the person standing next to them could be vaccinated, so it's not going to spread to them. It's not going to spread to the next person. It's all about like how close you're standing to someone, and how long the breath droplets linger in the air, and where the conditions are where you are, and whether or not you have your mask on properly, and all of those things. And all of that contributes to the risk, and why it's so contagious starts to be mitigated over time the more people you get vaccinated. And that's just the herd immunity argument. The bigger picture is that, we need to prevent as many people as possible from getting sick, because our healthcare system cannot take it, period. Like that's part of the issue. And then also, I don't want your people to get sick. Like, it's a really serious illness for a lot of people, and some people it's a death sentence. So there's like a myriad of reasons why people need to get vaccinated. And those are just 3. So, yeah.
Now, some people have expressed concerns about the ingredients of the vaccine. There's misinformation going out that the vaccine is composed of aborted fetuses, and that it can cause a myriad of unassociated diseases ranging from AIDS to autism.
Wow. I don't know, like, where would you get that many aborted fetuses is, I guess, my first question about that. Where is there a repository somewhere that I don't know about?
Probably.
Yeah, I actually have like a little side by side I wanted to check out, because I'm pretty sure it's just like you know, they're housed in basically essentially what's little like lipid droplets, let's say, and that's how it's sort of delivered in the vaccine injection. But to answer your question, no, I mean, it obviously, I mean, it wouldn't have been like approved by the FDA for one if it had any of those things in it. You know, again, it's a messenger RNA virus and vaccine, and so essentially it's just you know, a little piece of RNA, so just the protein itself. And once the code is communicated to your cells, the signal is degraded. So there's no further action after that. And, you know, it's been a rapid development, you know, so I understand, you know, why people are so reticent about it. But I think, you know, we need to understand that over the past couple decades, we've had, you know, a lot of time to study coronavirus for one, from the SARS virus. And, you know, we have the technology and the methods now to have, you know, rapid vaccine development platforms. And though these are the first messenger RNA vaccines that have been approved, they probably needed to have been approved sooner, I suppose. But, you know, obviously the urgency of the situation maybe pushed them forward in our acceptance of the science in a way. But they're perfectly safe.
Although some people, there's another conspiracy that some people are, well, I think there were a couple of people in Alaska and other places where they were allergic or they had allergies or something, but that wasn't related to the vaccine itself, but a material that's within the delivery system of the vaccine. Is that correct?
Well, I think that they did have a couple issues with allergic reactions in the UK with the Pfizer virus. And I think it was people just in general with a history of anaphylaxis. So there is definitely a recommendation for people who, for example, are allergic to medicines or food and carry EpiPens to let your medical provider know, like, don't go to CVS maybe and get the vaccination, like, you know, let your doctor know and make sure you can get vaccinated sort of in a space where they have, you know, medical equipment should you need emergency attention. But I don't think that they, you know, they don't think that it's sort of causal from the vaccine, but because they've had those reactions, that of course they've had to report it, and they're giving that recommendation in terms of people who might have allergies. So that's a big consideration. Like, I have 2 kids who have peanut allergies. I'm definitely gonna probably chat with the doctor before I just take them down to CVS to get it. So yeah, and then there's also been, you know, in the clinical trials, at least in the Pfizer trials, for example, there were a few deaths, and most of those were like cardiovascular events. But, you know, after, you know, sort of based on like just the statistical analysis and sort of the age groups of the participants who died during the study, they also deemed that to not be related to the vaccines itself. I think for the Pfizer vaccine, you know, you might have the typical side effects that you would get with a vaccine, like, you know, some maybe soreness at the site of injection, or headache, or like even, you know, for example, with the flu virus, you might feel a little under the weather for a few days, with the flu vaccine rather. Again, they had the severe allergic reactions in the UK, and the few in Alaska that they're reporting. And then they also had a few people in the US who developed Bell's palsy, which is just kind of a temporary facial paralysis. Again, they concluded that that was unrelated to the vaccine, and they did not conclude that was there was a causal relationship there. But they do have to report it, so that's why we know.
But the doctors already have guidelines for
Yeah.
who should,
Yep. The Moderna virus vaccine, which I think is going to be approved, and I think they're going to chat about that today, Thursday. It's not quite Thursday there probably, but that the Moderna vaccine, they had the same sort of side effects, like with pain at the injection site and maybe a little bit of headache, pain, and chills. And then they also had 3 trial participants who developed Bell's palsy. And so that's, and you know, but that's 3 sort of out of, you know, 50,000. And so that's why it's not deemed like statistically significant when you think about, when you relate it to the proportion of the larger population. They both like require 2 doses, so that's also going to be important to communicate to people and like to keep to make sure that people go back and get that second dose, because you're going to need to have both to have protection over time. It's interesting though, because the Pfizer one is the one that has to be like in like deep freeze conditions, but the Moderna one, if it's approved, I guess, you know, it's a little more stable at higher temperatures, so it might be easier to distribute. So we might end up seeing more of that in the later rollouts. But so far, that's all that they've reported in terms of serious side effects.
I want to talk a little bit about distribution, especially how it relates to disparities within our healthcare system. As far as you know of, they are delivering the vaccines according to an algorithm. Is that correct? Or
so they kind of have it blocked out in allocation stages, and so in the first sort of phase, higher risk health workers, like people working in hospitals and nursing homes, will be in that first group, and first responders. And then the second part of that group will be sort of like higher risks people in general in the population. So people with underlying conditions that put them at higher risk, or people over 65. So the elderly will be the next set. They get it right after the hospital workers. Yeah.
But isn't it also true that a lot of people distrust the distribution of the vaccine because of their experiences with the healthcare system?
Yeah, that's one of the biggest issues, I think, definitely in our community that we're dealing with, and it sounds like in a lot of your communities as well.
So yeah, why don't you talk about that a little bit? You as a doctor, a Black woman, what has some of your experiences been being treated?
Yikes. So okay, for example, my mother was a dentist, and she did like surgery and stuff, but she never did any of ours. So when I needed my wisdom teeth pulled, for example, a Black dentist, took me to one of her colleagues, and he he didn't like numb me enough, and so like I basically felt the whole thing like back in the day when they just gave you like some whiskey and tied a little string around your tooth. And that was the first time like I realized that, because he was like so rude about it too, like he was like irritated that I was like upset because he wasn't listening. I could feel him digging into my jaw. And that was the first time I kind of realized just how much doctors can take their own personal biases into an exam room and do harm to people through that. When I was at MIT, my appendix had burst, and I went to the medical center on campus, and he insisted on doing like a pelvic exam, even though I told him I wasn't sexually active. And then he just kind of concluded, he was just kind of like, well, you either have like an ectopic pregnancy or appendicitis. I don't know. You should come back tomorrow when attending is here. And I was just like, either of those things is a real problem. You know what I mean? And so I was like, I'm just going to the regular ER. And like I went to the hospital, and I got there, and the surgeon literally, he walked in the room, and he just tapped on my stomach, and he was like, take her upstairs. And that, like, if I would have went back to my dorm room, I would have died, and that was like 20 years ago. Like, that's not, I mean, like, we don't have time for me to talk about everything. We don't. I mean, we just this week, and a Black female doctor in Indianapolis was denied care continually in one of our university hospitals downtown, and ended up dying because she was insisting on getting the antiviral treatment because she had COVID, and she wasn't getting care. She wasn't getting palliative treatment in terms of pain medicine, which is a huge problem for us. Like, we just sort of, I guess, have to suck it up and rough it out. We don't get inundated with Oxycontin. We get to live with our pain, and we don't have time for me to get into that. So, I understand mistrusting doctors. I don't trust doctors, period. But I do.
Especially when they're lieutenant governor.
But I do trust science. It's a different profession, you know what I mean? Like, there's complete transparency and complete oversight in everything you do, every test tube, every lab notebook, every single thing that you do is vetted and QC'd and reviewed, peer reviewed. And when you're a scientist, the whole credibility of your name rests on truth and transparency. If you cheat, if you make something up, that's it, it's a wrap. Your career is over. Hang it up, forget about it. You know what I mean? And it's like, you can be the difference, I guess the difference in how we experience these things is how we can be harmed by people's biases in the exam room. But, these teams of scientists that, designed this vaccine and, got this out here in time for us to, mitigate our refusal to do the right thing. I do believe in them. I do trust them. So, I mean, it's unfortunate because I feel like it's hard to combat that messaging when you have people who, have either been, used unethically in human research, or have experienced personally, like inadequate care, and most people, a lot of people don't even have access to care, let alone equitable care. So it's hard to combat for sure, but I guess that's why it's so important to emphasize the life or death stakes that we're talking about here.
I wanted to open the question up to also Nadine. Have you, as a Micronesian in Hawaii and in Guam, have you experienced or felt like medical professionals have had biases against you, or you have been mistreated in
I feel like I could write a novel with all the different instances that I've experienced personally, through family members, through friends. It's almost common that some conversation, some kitchen conversation is about a doctor's visit, or if they even got to a doctor, a visit to public health ended up in, you know, feeling hurt or feeling like a, you know, like a, it's a nice way to say it, like you know, unworthy to be even seen or be heard. There's just so many, and again, yeah, it's too long, and I can count on one hand some positive experiences with going to like clinics or hospital, very, very limited. But I guess I'm also, and many others that I know, were in this situation where we have no, it's like she's I've shared, the doc has shared, it's like it's a life or death, right? So you either die at home or you die at the hospital. And sometimes the one big factor is, do you want to die and leave your bills for your families to try to figure out? And, you know, in thinking of the vaccination, you know, I was just trying to read up on like what Guam's plan is. They have these, their phases of vaccination, what the total number that they're thinking of that be covered or vaccinated by the by early 2021. And right now, obviously I don't fit any of the tiers or the phases. I'm wondering about people's access to those information about or notices about those phases so that they could go to it. I haven't seen much communications about it, or at least for my communities to reach it or to know that's going on. So that, like, that already I feel like is a gap that could have been avoided if we were, if certain community leaders were involved in the process. I feel like it's going to be like back in March, where we weren't like they weren't reaching out just because of other biases or just kind of ignorance, or like, you know, kind of thinking that it was going to go away or whatever the reason may be. I could go on. I just remember feeling just because a couple months ago when we were finally asked, me and other volunteers in the FSM community organization, we just like went all in to do like a campaign, a social media campaign, and just combating myths about the virus or going to get tested was so hard to try to communicate to our people. So like that was the first step for us to try to even get to. And now we're in this stage where it's about getting vaccinated. At least I don't know, I haven't been reached out by public health to like help with communications like I did a couple months ago. But to me, that just really reinforces that cultural divide or gap that exists between, you know, Micronesians on Guam. You know, people from here also consider themselves Micronesians or feel like they can call Micronesian people from the Federated States or freely associated states of Micronesia brethren, but sometimes it's not translated into action, and then it becomes too late. And then we get to these situations where, you know, we could have saved, or we could have avoided a lot of heartbreak or you know, saved some tears. I'm just always so sad when I think about those. But, you know, I have a full-time job. I have children at home that I have to, you know, keep safe and healthy, you know, work with them at school. So I'm all the community work I've been doing from home, in addition to all of that, like I was doing it out of love for my people to have a fair fight in this against COVID, really. But you know, I'm already thinking of elders that I know, if they knew about the because they would fit under the phase 2 of Guam's plan for vaccination. You know, now that knowing that there would be symptoms or other things that will kind of happen after vaccination, does that mean that they'll have, if they get sick enough, will they need to go to hospitals? Will they be able to afford their copay to even go to clinics? Would they keep struggling after, if they have no choice but to go to an ER and they come back with like a 3,000 bill for like a maybe like an 8-hour stay in the ER, but only of which only 1 or maybe 20 minutes was seeing a doctor? Like, it's just really mind-boggling. But it's a continuous battle, you know, for since I recall living in Guam, when not really Saipan where I was born, but in Hawaii. But people I know just go through it, and really it's become so common to just exchange stories of horrors in the hospitals, of being mistreated. I remember going with my mom when she had to get she was getting ready for a surgery, and after her post-op visit to the doctor, because I had so many questions and I wanted to understand her health, the concern, he just kind of dismissed me and kind of was like irritated that I had so many questions. Like, I should have just believed it. I should be fine with that. I should be grateful that she even got seen in the first place, or that she, you know, had MIP. So in Guam, there's a Medicaid coverage for people, and then there's their own local plan called the Medically Indigent Program, and that program, people that qualify for that will have some coverage. It's really underinsured. That's what I think, because people that I know who have it, who are under it, still do not have the means to pay their copay. So that becomes an obstacle for people to want to seek help, right? Because they're thinking of what I'm going to pay, or what can I, even if you do see the doctor, can you pay for the prescriptions that if you need it? So it's really a constant battle, and I'm all for the vaccination. I believe in science. I think science is really in our blood. It's just they didn't have the name science, the Anglo word science for it, right? But I'm gonna try my best to communicate the importance of it. I just want to make sure that the people who are in charge or in these important spaces or places of power or position of power to let go of their biases in working with people that they need to address or to help. That's what I would really like to see. But yeah, hope that answered your question.
Yes, thank you. Clarissa, have you experienced any biases within our healthcare system in Hawaii?
Yes, I would say like more so like in women's health. I mean, I'm like only 23, but I guess like it's crazy to like how like affected by it. I mean, if we're talking about like sexual health and IUD installed at like early on, and then having it like fail, and it's really negatively impacts my body. And then like going to the doctor 2 or 3 times and telling them like, you know, I think this is really like painful. It's like stabbing like at me in my uterus, and they're like, no, it's supposed to be like that. And then like, okay, I go on for the next like 10 months with it inside of my body, and it's like, no, I can't do this anymore. And then now like I got it removed, and then I'm hearing that there's like a factory recall on this specific device because of how like bad it is, and it'll embed itself into your uterus, and that's exactly what happened to me. And for it to go on for months, and then my doctors say like, oh no, it's nothing. It's like crazy to me. And then I'm also like, I have like, I want to say it's from the IUD itself, of like it being embedded into my body, and then it created a cyst because of like the, I guess, like of the scar tissue. But then they're like, oh no, I don't think so. But it's like, okay, I guess you're the medical professional, so they chalk it up to, oh, like you don't exercise enough, and like, do you drink and smoke? And it's like, oh, it's because of that. You should like take care of your body better. And it's like, I'm like only like in my early 20s. I don't know like how much healthier I can be, but okay, I guess I'll just exercise more and drink more water then. And it's, yeah. But that's like the most intense part of it. For my mom, mostly she goes through sees more doctors because she has more metaphysical ailments than I do. But even then, like I try to make it to all of her appointments, but I can't because I'm a student. So, but when I'm there, I make sure, like, it's always so wary because sometimes like, I don't know, I get wary like with like her bedside care, if like they're being nice to her. From what I've seen, it's okay. Sometimes like some of the nurses are like not. I've heard stories when my parents go and like they don't treat them well because of like their heavy accented English. And it's like, oh, they don't understand. And it's like, oh, we were just playing around. But it's like, no, you have really terrible like bedside manner. And it's showing, and you're chalking it up to them not being like on the same speaking level as you. But yeah.
Noilani, do you have stories about experiences that you have had?
I do. I actually have a very similar story to Dr. Neecey, from being a child and going to a dentist, and I couldn't open my jaw wide enough, and the doctor started, it was an old white guy, and he started yelling at me to open my jaw wider, and I literally couldn't. I had a tight jaw, and he was trying to pull my jaw open, and I started to cry. I was only like 8, I was little, and he put his hand over my mouth, but his hand was so big that it covered my nose too, so I couldn't breathe. So I started to flail because I was, I couldn't breathe, and he just thought I was hysterical. He thought that there was something wrong with me. And, my mother came back and calmed me down so he could finish because they had already started the procedure. But that was traumatic. That was really, really traumatic, and as an adult, I don't go to Western doctors very often unless I really need to. I didn't have health insurance for many, many years. And I was also very afraid to go and get a bill that I couldn't pay for. And, in general, I took care of myself, and I had, because of my Chinese medicine background, I have access to other forms of medicine to take care of certain things. But when I do need to go to the doctor, I'm really careful about kind of researching who's in the clinic first and seeing if I can try to, go on a shift when I know there's going to be a woman of color working. And, I always ask for women. I really don't like going to male practitioners if I can avoid it, and trying to see doctors who are women of color who make me feel safer, because there's bullying that happens sometimes that I've experienced, and even with other patients when I've gone to advocate, I've seen doctors really bully people into doing things that they don't understand, and oftentimes it's just because they're not willing to listen. That's why I think this conversation is so important, because I think the more that we can actually share our fears and share our historical experiences around medicine, it helps us kind of clear some of that so that we can think a little bit more clearly about what we need to do going forward and the choices we need to make, because there is a lot of medical trauma that I've been witness to and experienced myself. So thank you. Oh, I think you're on mute, Adam.
Kahala. Yeah, sorry. I went to a slightly different angle, but like for me as a as Hawaiian, as Filipino, and queer, especially the queer part, I'm very leery about certain doctors because I feel like, I can personally feel like they're kind of homophobic by the way that they're asking questions. And I was wondering if you had similar experiences.
Oh yeah. Every time I like go in, and once they feel me out with, it's that medical gaze. Yeah, they look at us and they're already trying to diagnose just from our from sight. Yeah, that's how they're trained. But tone of voice, mannerisms. I come in like just wanting like to do a regular blood test, and they all hit me with like STIs automatically, and I'm like, I don't need this. So there's that part. There's also like there's also stigma, I know, for us, because we always are going to get, if we don't, we're not passing, I don't like that word, but we oftentimes will be placed with the male doctors, and I have a really hard time with male doctors and just men in general, like looking at my body and piercing that piercing gaze, and touching. It's also an issue for me too. But standards for medical practices, quote unquote, same sex kind of thing that goes on, and so yeah, there's that kind of invasive treatment that happens. We're not recognized as Māhū, like another gender or sex other than male or female, and so that's also an issue, and particularly for our trans people in our community. But other than that kind of medical mistreatment, I also have a similar situation with the appendicitis. I have like a scar that's that big on my stomach, because I was admitted. Well, I went to the emergency room in Queens, and it was like my appendix was going to burst, and it eventually did. Only a couple minutes before they actually put me into the to be treated, but I was waiting outside for like hours in pain, like doubled over, and the doctors were just having like these conversations. They look over and then comment to each other, just talking about like the holidays and all that stuff, and it was just dehumanizing, and so I kind of want to just take that, and I want to give a kind of like practice and accountability. So if you are one of these doctors or practitioners who is watching this, and you're privy right now to all these really these shared mo'olelo, these stories of pain and trauma that we received, we need a lot more from you folks, because this is a pattern, and therefore it's something that you should be paying attention to. I know it's really, right now, COVID and whatnot is a really difficult time, and you folks are on the front line, but this has been, it's a pre-existing condition. It's been happening before this pandemic, and it will continue. And we don't want to be treated that way. And it actually impedes your ability to work with our communities, because you're not able to see your own authority and how that authority affects the relationship you have with your patients. And so, this is a loving call out and call in to medical practitioners who are seeing this, who are in a place of position of power. Listen and believe us. Don't second guess us. And super important, study not just our personal medical history, but our collective medical history. Know what it means when a Hawaiian, Micronesian, Filipina, queer, trans, Black woman, person comes in. Like, you need to know that history, that collective medical history, because otherwise you're going to lose the capacity to practice your healing tradition, right? So.
Yeah, I think that's really powerful, because I feel like so many of us sort of give this moral weight to the practice of medicine, and it blinds us to the fact that, you should demand more of your doctor. If they so-called have sworn an oath to do no harm, all of us should demand more,
But it's also important for doctors to gain consent. And I wanted to talk about that because Noelani wanted to talk about that. what are some steps that doctors can take or medical practitioners can take to gain consent and to make their patients feel like they're not being forced to do something or to be culturally appropriate as well? So I wanted to just go around the panel for your suggestions on this and also your manao on this topic. So let's start with Nadine.
You know, I think I'll disclose that I don't have. I'm while I'm an advocate for getting healthy and believing science, just from my own experiences, I haven't been much to clinics or hospital, and I have some health issues that I continue to get put in that that reminds me to go. But I'm gonna try to. The only thing I can try to speak from experience is when about that is when I had my first child, my daughter, about 10 years ago. I was in the hospital when I, in labor, and I was in the hospital, and there's this. As I was like in my early 20s, and I remember like having this plan, this vision to have a beautiful, while laborious experience with giving birth. I was in a situation where I was made to feel like I had to just choose getting a C-section, and I've had 2 more after that because of the same doctor and same hospital that I was in. And it didn't dawn on me then, like it did with my last child 3 years ago, because I did try to go another route. But I just remember feeling the pressure to decide on something, which later on seemed like, it was after that I started seeing some articles come through about, some peak times of surgery, of cesarean surgeries because of breaks or doctors wanting, for convenience of time, right? There was some correlation between that. And I just remember kind of like, oh my God, was like part of the statistics. Because then many other mothers I knew around the time all had cesarean sections. Very few, a handful I knew that were able to go to a clinic, a birthing center that, really tried to do the natural childbirth. He was a white male doctor, been in the industry been in the business for so long, and it felt like I remember the way I saw him when he came over to tell me that the different factors I had to think about as to why I should decide already to go into surgery. I remember it was like a scary moment for me and my partner and my families, but I remember kind of seeing him come in, and it felt like more like a coffee or tea situation. Like he just kind of came in like, very, very nonchalantly, very kind of casually, but also in a way kind of scared me into going with the surgery. And then things that I've internalized to different people's reactions to me being Micronesian or being difficult to people. That kind of feeling was already in me. So I was like, I'm being so unhelpful to this doctor who's like giving me his time. He's a busy guy. So that kind of thinking made me felt bad about being in that, that's how I thought of it, that I was inconveniencing him on my hospital bed. And because of that kind of mentality, and I feel like many other women, Chickees women I know are in those situations, and I don't think they've ever really voiced it. They've kind of also just, it's become almost normal to feel like you can't question the doctor, and whatever decision they make for you, it's for your best interest. And when you do question it, or you do, feel like you want to ask, tell something else, you're kind of made to feel like you're how do you say, that we're you know, stupid and we don't know better. But because many people that I know that who have, you know, bad historical medical reasons or situations, and that's why they continue to migrate, or they are underinsured, they felt like that was their best choice and to just go with it. And then there's long-term effects after that, but there's no way to kind of trace it to that moment that you had to make a decision that really was going to be harmful for you, potentially harmful for you, and affect the way you also are going to heal. And that's why even for my second child, like I was scared to think that if I were to try to do natural, I would get, you know, I would possibly die. and also, I'm sorry, that's all childbirth, but I almost liken to this idea that, you know, you go to these clinics or see these doctors for life and death situation, and you can still feel so lost, but you can also still feel so, I don't know how to say it. You can still feel so, I don't know how to say it. Sorry, I'm rambling on. I really like what Kahala said about practitioners needing to be more conscious about the people that they're helping. And I think that would be the best way, is in addition to medicine, whatever, you know, whatever field in medicine they're undertaking, that they also be, you know, versed with meeting the people that they're going to be serving, and again, what everyone's have said is, you know, putting aside their biases. At least with Chukis, there at this moment, I don't think there's enough work being done, just even from our own community. At least here in Guam, for me, there have been people, pioneers before me, but there's still that struggle. And I'm still learning about that. I'm still learning how to navigate it. I'm still learning how to articulate it. But that's the state that it is for people like me or people from my communities. And I think we would look to people like Noelani and Dr. Neecey and Kahala and Clarissa, who have you know, who have we can really learn from them. I think us being kind of new to in Guam or in Hawaii. But I think it also needs to be, I need to also note that even amongst us here, because there's still also some bias between like the newcomers, you know, so sometimes even that obstacle can prevent people like me feeling comfortable with sharing some bad experiences or feeling like we're worth listening to. You know, it'll empower, I think, some of us to join, you know, be more collective in working with other people in this to amplify these kinds of stories, really. I think I'm still at the stage, so I'm really learning from you guys, and I still need to learn about my own people's migration and stories. But yeah.
Sorry, I wanted to quickly just mention, but isn't it true that, you know, at least within the Micronesian community, even sharing these types of stories, some people will consider it to be complaining, and complaining is discouraged in Micronesian, in most Micronesian cultures. Yeah. Is that correct?
Yes, and I think that's why it's such a, personally, it's so conflicting, this idea that we want to voice what is ailing us, but then we also don't want to, we're always supposed to be very humble and supposed to be very, you know, considerate. And so the idea to voice your ailments, and sometimes when we do have that moment to voice it, we're met with people who will kind of question or belittle us, you know, and so it reinforces that idea, like, okay, we're going at this wrong, we just have to go with the flow, you know. And I've had many like friends, my friends who are in a better situation or position have like tried to empower me to like be more assertive, be articulated more. But I would also laugh at the irony of them telling me this as a person of color or a person from Micronesia to feel so confident when we go to clinics. But I think I've grown over time, because now I would be called, relatives or friends will call me to go with them or to talk to people that they see, because at least I can try to articulate what they're feeling or what they're saying, because sometimes that miscommunication can really hurt like people, like Micronesians going into these places, but it can also just feed into that bias and keep reinforcing that bias and misunderstanding or ignorance from other people, because no one is questioning them in the language that they understand, So we're, at least people like myself and others, we're like in the middleman to try to express that from the Micronesian voices way, and then also, but in the language and the manner that the person giving assistance or whatever will be able to listen and understand. And so, but yes, we're always so conflicted with that, because that's the idea, that so we just go with the flow. And it's ironic enough that many of our people have pre-existing conditions, and that's why they immigrate out to go look for better healthcare facilities, right? But then then they're reduced to being either uninsured or underinsured, and so they work themselves to death with no promise to get better, so that they can continue to live and be able to provide or reach their dream that they that made them travel in the first place. So it's just, yeah, so complete conflict and irony, really, for many of us.
Noilani, what are some suggestions that you want to give to healthcare workers, healthcare practitioners about consent?
Well, I want to kako'o what Kahala said, absolutely, about medical professionals educating themselves about the populations that they're working with, and understanding the historical trauma, colonialism, slavery, the medical trauma. But beyond that, I think it's really about listening. And I know that the medical profession, the hamster wheel that they're in forces them, because of insurance, to only spend 15 minutes per patient or only 10 minutes per patient. And, my doctor friends, just a shout out to Kalama Oka'aina, Dr. Kalama, the other founder of the Mauna Medics, Healers Hui. We talked about this a lot on the Mauna, how she, as a Kanaka Maoli practitioner, she works really hard to be able to sit with their patients and listen to them. But it's really frustrating when the insurance is like, the clock is ticking. So I think we have to address the whole system that they're forced into too, because a lot of our doctors who are people of color are stuck in that situation, and they're trying to find ways to navigate it. But because of that time crunch, there's really a lack of listening. And I think sometimes if practitioners can just hear their patients, if they can just allow their patients to be truthful and honest, because like Nadine was saying, a lot of times patients feel shame, or they automatically feel like the doctor is talking down to them or belittling them or making them feel stupid or like an inconvenience. That's just wrong. It's wrong, and it's heva. We're all human beings, and we deserve to be treated as human beings. Our humanity should be uplifted. Our medical professionals should be considering our health and well-being, not just the numbers on a blood test or a diagnosis. We are not our diagnoses. We're human beings. And it's magical what can happen when people feel listened to. And then they can be in a clear place and they can communicate back sometimes what some of their needs are that maybe aren't being addressed. But a lot of people are just plain afraid to speak up. Because even for me, as someone with a master's degree in science, sometimes I've been in situations advocating for other patients, and I've been demeaned and made to feel like my ike is not important. It's different. It's not the same, but it's important and it's meaningful, and I deserve to be heard. But I myself sometimes feel that same feeling of like I'm taking up too much time, or I know that they have to rush, and I'm just not that important. And that's something I have to do. You know, we as people of color have to continue to work on in our own selves to clear that trauma so that we can speak up for ourselves, and we can speak up for our tutus when we take them to the doctor, or our keiki when we take them to the doctor and we're being bullied. It's really important that we find that that we take responsibility to speak our truth, because there are going to be practitioners out there who aren't going to get it. And it's wrong, but it's the reality that we live in. And so I hope there's practitioners listening, and I hope that you folks will listen and just take the time, take a deep breath before you walk in a room. Don't make people feel like you're an inconvenience and you're being rushed. So, thank you.
Clarissa?
Yeah, I would probably just reiterate what Noelani and Kahala and Nadine has said about continuing to learn about the community that you're serving, and to really spend the time to understand their ailments, and not really put the blame on your patient for having such ailments, and really kind of helping them like figure out like what they could do next. Because I feel like it causes a lot of people to suffer in silence, and there's too many cases of like BIPOC people like having like ailments that they die from, and then they do an autopsy, and it's something like it could have been like an ovarian cyst that like have been ignored, and it built up, and it basically killed the person. And that's really, it shouldn't really get to that point if it's something that could be like solved right away. So yeah, just that.
Dr. Neecey?
Yeah, I mean, I don't have an answer to the question. I guess I want to say that up front. You know, even it's so frustrating, even for me sometimes. You know, like I can be using the same terminology and everything, like, you know, like I'm trying to communicate to my doctor, like I'm on the level, right? And I still get treated like I don't even know how to describe it. It's just disregard. And yeah, I mean, this is something that's like, you know, I think one of the hardest issues that I deal with personally. So it's not really always easy to talk about, but I don't have an answer is my answer. I think that for us, we're trying to figure out ways to intervene in people's lives and supplement the shit care that they get from the system, whether that means helping them have better access to food and nutritional health, or whether that means, you know, teaching them, you know, how to grow medicinal plants again, and how to do home remedies again, or whether that means, you know, trying to find people like Mauna medics, you know, that want to come and give their time in the community and give a shit. I don't have an answer. I don't have an answer for my own life. But what I know from my own life and from what we're all going through is just like, we are all that we have, you know what I mean? And so the coalitions that we build in this critical time, and the energy that we spend the things that we spend our energy on, you know, it needs to be always in the back of our mind, knowing that we are not going to be able to ask for help. We are not going to be able to petition the system. It's not going to change in our lifetimes. Nobody's coming for help. Help isn't coming. So what are we going to be able to do for each other? Who can we pull in? What can we get for each other? Because I mean, the help is not coming. I don't know what the answer is. Damn. Sorry. I don't know what I would say to any practitioners about consent or anything else, because at the end of the day, they're humans, and I don't know what to say to other humans who don't value the lives of other humans. If I could figure that shit out, then I would be doing that instead of hood medicine. So I have that rant for you. That's my answer.
Kahala, would you like to add?
I think Dr. Neecey really touches on a really good point. You know, we're all that we have, and I think for myself, whatever our however we approach the vaccine, and keeping in mind, you know, those stakes, life and death, folks, and potentially, you know, potentially trying to change a history for ourselves regarding a relationship to death and disease. Yeah, what kind of ancestors do we want to be? It's an unfair burden to put on us. But I will say this: we are also each other's medicine. There's vaccine, and then there's medicine, and the movement for Black Lives, the movement for Mauna Kea, the movement to protect Oceania from the militarization that's happening, the movement to love each other. Yeah, that's our medicine, and I believe in that. I absolutely trust and believe in that. That's all I want to say before I cry.
Oh, Dr. Neecey, sorry to go back to you, but do you have any final thoughts?
I'm a mess. I'm
No,
just so moved.
you're
I know
human.
I'm just so moved by all of your stories, because I feel that there's connection there, obviously. And it's moving to me because this is the time in our evolution as a species where we need to honor the connections that exist between us. You know what I mean? And that's what hood medicine is about. And I just feel like a little overwhelmed, because after hearing everything that you all have shared, I feel like there's a lot more work to be done than we thought. But I'm honored that you invited me to share this time with you, and I'm really happy to have met all of you. And I hope it won't be the last time.
Nadine?
You know, I was really worried about the invite at first, because I was worried that I wouldn't be able to contribute anything worthy. But it was nice to be in a space where to feel feel just as comfortable to share, and that what I'm sharing as maybe not as articulated as it could be taken seriously, right? But I just really love what Kala was sharing, because I think that's what I think subconsciously that's just what keeps me going personally. I think that's what keeps a lot of people who either don't have many choices or don't have the luxury to come up with to find other means. And but it's beautiful because it speaks to who our people were thousands of years ago and who we will continue to be, because they've resisted and have thrived for so long. And so I just I'm gonna treasure that. I think it's different hearing it from somebody outside of my own circle. I think that it really just makes it so much more the hope that I have more, it deepens my hope for humanity, I think. Because you're right, we're really all that we have is each other. And I just thank you again for inviting me on, and I get to meet you all, and I hope that the people watching can also really take the time to not just take a first glance at their neighbors that might look different, but to be inspired, or to feel more to want to make a deeper connection, or really make a deeper relationship with others. Yeah, and because love is free, and that's all we can, at least that's all I can afford, prayers and love. So that's all I can offer to everyone here and anyone watching. I'm really thankful. Thank you.
Clarissa?
Oh, sorry. What?
Final thoughts that you want
Oh,
to articulate to the
um,
viewers.
yeah, I think how we were saying about the human connection and how we are each other's medicine, I think that's really important, and we're all kind of figuring this out together so that we don't have to continue to experience what we experience when we're seeking times. But we're experiencing when we're at our most vulnerable. So yeah, I think that's really important. Yeah, I'm glad I'm able to share this space with everyone here, and well, we're going to continue to figure this out together.
Noelani?
I'm just so honored to be here with all of you and make these new connections. And it's true, we are each other's medicine. We talked about that a lot on the Mauna Yakahala, about communities of care and how we can take care of each other, starting in our piko with our ohana. And I think one of the good things to come out of this pandemic is this use of technology. I never Zoomed before COVID, and now we have this opportunity to share space in such an intimate way that's being broadcast all over social media. But we can still make these connections even through technology, and the more we can build our pilina and our relationships to each other and hold each other up, it's really, really powerful. And as far as the vaccine goes, I've been thinking a lot about this, and I want to thank Dr. Neecey, because I had my own little shift in the course of this conversation. And I think hearing the mana'o out of the mouth of a woman of color made it easier for me to swallow, to be honest. And I read the study. I read the Pfizer study. So, nothing is perfect. No vaccine is perfect. But again, when we're talking about risk versus benefit, I do think that for most people, not immunocompromised people, it hasn't been tested on pregnant women yet, and it hasn't been tested on children yet, but for the general population, I think that the benefit outweighs the risk at this point. And I will be having these conversations in my community. I do, though, I will work not to shame people who feel differently than I do, because that's part of the problem that creates the distrust in the first place. Shame never helps our people. We already have too much shame. So I'm going to find ways to have these conversations in meaningful ways, and listen to my own advice, and listen to people when they want to talk about this, so we can help people. I can help my patients make the best choices for themselves and their families, for their health and well-being. Thank you so much for bringing us all together, Adam, and thank you to everyone on this in this circle.
Kahala.
It's amazing. Merry Christmas, everybody.
Merry Christmas. Final thoughts. We were talking about this, Noelani and I, in terms of our movement building. We don't really talk about vaccines. Actually, Dr. Neecey was talking a little bit about it, but we another thing to think about with the vaccine is the buhonoa on Mauna Kea was shrunk. It's still there. The folks who are holding it down for our movement in Mauna Kea are still there. Nakia Ipa are still there, but our capacity to hold a space against a development project like TMT was largely affected by COVID. Yeah, and so the vaccine may tactically provide us a way to look at organizing again, because that has been a struggle. Yeah, even though we're gonna stand for our lives, for Black lives, for for the Māna, we're gonna do it anyway, but we always would have that risk, of unintentionally potentially infecting others. And so this is something else for us as organizers to think about, to really hold that. And then the other thing I wanted to say is that from the queer community, LGBTQ community, Māhū, we don't have a vaccine. And so for those of you who are really hard on the anti-vaccine argument, I hear you. I hear you. I know. I don't trust government. I don't trust market profiteering at all. But I also want you to hear us, that we don't have a vaccine. You folks, all of us, in terms of COVID, there is at the very least a choice. We're still dealing with it as a community. And so it's not a shaming. It's open your consciousness to remember that our community is still being affected by something for over 30 years now. There is no vaccine for us. We're just trying to manage it. So just things to think about, more mana'o to be educated on. That's all.
No, that's a good point. Especially in terms of not only getting back to, the important work that you're doing in Mauna Kea, but also getting back to life in general. I mean, the sooner that everyone goes out and gets it, the sooner that, we'll start to achieve that herd immunity that we would need to kind of get back to life as normal. And so for a lot of you on the front lines in these liberation fights and these fights for sovereignty, and that's going to be important, obviously.
I just wanted to also say that, within the Hawaiian community, yes, we have a lot of historical trauma because of the various epidemics in our history that wiped away 98% of our population. But we also have these moments where our people not only resisted, but they tried to build something to resist. And I think of Queen Emma, for example, founding Queen's Hospital. And that was in reaction to the Hawaiian government at the time not granting a public healthcare system. And that was also in reaction to Hawaiians not being able to get vaccines for the diseases that were wiping us out. And I also want to, bring up Queen Kapi'olani, who built the maternity home because she knew that women were not getting the type of care that they had deserved. And so we have all of these stories from our li'i, from our ancestors, our kupuna. And we are here because of them. And it's our kuleana to be here for the next generation, the following generation, and to always remember that no matter how dark the times are, there's always going to be light. So I'd like to thank everyone for being here, for everyone's mana'o. With that, I'm going to be closing the panel. And again, malama pono everyone. Thank you for being here.
Thank you.